to forget these things? Perfect. And also, if you guys can see on the bottom of your Zoom bar, there should be a closed caption button. Let us know if you don't see it, but you would like to have it. Then we'll try to troubleshoot. But if you hit that, you will get the spoken word typed out. And our captioner is Ramona, who's typing this out for us. All right. We still have some people filtering in. We'll give it another minute or so. I also think that's summer, so I think people are starting to take a little easier life during the summer, hopefully, and taking some break on a Friday afternoon. Although maybe not outside, since it's like a 90 at least here in Boston. All right, and then Hazel, if you want to bring up our opening slides. Perfect. So I'm going to move somewhat swiftly since most of you know what we are and what we do here. But this, as you know, the overall project is an initiative funded by the National Institute on Drug Abuse. And the goal of a project is to basically build the research infrastructure, which is to say build collaborations between multiple stakeholders to enhance the study of recovery community centers. And of particular interest is also the utility of RCCs and RCOs to support persons using medications for treatment for opioid use disorder and issues around that. And here on this slide, we've put together for you the steering committee. We meet regularly to kind of discuss what we're doing and what else we need to be doing. It's a mixture of people from multiple stakeholder groups. Hopefully you recognize many, if not all of the names at this point. My co-leader, John Kelly, Dr. John Kelly is not here today, but sends his regards. So you will have just me today, but he'll be back for the next time. Next slide. We just wanted to give you a brief update before launching into our main events for the day about some updates from our program. One thing that we have mentioned in the past and we're excited to be launching very soon is a nationwide survey of recovery community centers. And the goal of this survey is twofold. What we want to do is we want to kind of see what kind of RCCs exist, because when we started, we call it recovery community centers. We quickly realized there's a difference between recovery community centers and recovery community organizations, and quickly realized that no two centers are alike. There's many different takes. So we want to know more about the diversity that exists, as well as where they are located, what communities they're serving, and everything around that. So that's one part of that survey. The second part is to kind of introduce some of the, or not introduce, but get feedback on some of the outcome measures we have presented in our series before. For instance, Dr. Joe O'Neill's recovery measure that tracks recovery over time, and to really get input from RCC directors on what you think about these measures and what's missing or what else you would like to measure or have us think about. So those are the two goals of that nationwide survey. We are going to be starting to email out unique links for each RCC that we know of to ask you, the RCC director or delegate, to complete these surveys on our behalf, and then we will compile the data and share it with you all. And that's going to be happening soon. If you don't hear from us, but you are an RCC or RCO and want to participate, please reach out to us. The second piece I wanted to mention is the Consortium on Addiction Recovery Science. And I have a link here where you can read more about it. Basically, our project, which is to advance the science on recovery community centers, is one of 500 projects by the National Institute on Drug Abuse. And the other centers are also looking at recovery support services. And we put together basically a page to just tell you what other topics, what other services they are addressing. And we put their project pages there. So if you're interested in what they are doing and what resources they have in terms of pilot study funding, mentoring, connections, any kind of thing, you have an easy access to find them as well. So if you click on this link, you'll be able to connect to them directly as well. Then one of the things that we like to do is connect the stakeholders, and one way is through participation in studies and collaboration on studies. What we have put together or starting to put together, and please, especially for the scientists in the room who are running studies, please let us know about your studies. But on, we don't have a link to our page here. If you can put that into chat, Hazel, actually, the R24 page on the clinical trials.
As soon as I'm not sharing screen anymore.
Oh, perfect. Yeah, that makes sense. Or Tingy, if you can meanwhile put that there. But basically, we have a page where we kind of list some studies that are relevant to the recovery community where you can consider participating. Dr. Joe Riggs actually made an even better way of doing that. He's created a whole map where he went through clinicaltrials.gov, which is the registration nationwide of clinical trials going on, and he curated that list for studies that may be relevant to the recovery community. And then if you click on that link, which is also on our website, you can find out about that. It's a wonderful resource. So take a look. Then the last point I want to make before going to our live feature is that we're going to take a little bit of a summer hiatus, mostly because we're going to be reviewing the wonderful grant applications we're going to be getting for our first round of funding. So our next seminar is going to be on Friday, October 1st. In general, we want to move to the first Friday of the month going forward to make it a little bit easier during the Thanksgiving Christmas period to still get these seminars in. So we'll be back on Friday, October 1st, and details will be forthcoming for the usual channels. All right, next slide. Now we want to go into the polling questions with you all, if you wouldn't mind. As you know this question, but basically we want to know who's in the room and who we need to reach out to. So if you wouldn't mind to complete this, you can use the little bar on the side to kind of scroll through here.
Yeah, and I think you have to answer every question before submitting your results. So if you can't submit, you probably need to scroll further and see if there's a question at the bottom.
Exactly. I'm doing this myself right now. And then the last question here, and this is one that you don't usually see, this is specifically related to our topic today about engaging the community around your RCCs and RCOs. And we wanted to know ahead of time, or rather Joseph and Phil want to know ahead of time so that they know how to pitch their comments about what kind of engagement strategies you're already familiar with and what we might want to expand upon in more detail. So if you wanted to do that, that would be great. And we included, and I don't know what you're talking about in case my explanation just now didn't make much sense, and then we'll do a better explanation. And then once you're done, on the bottom there should be a blue sign, submit, click that, and then you're good. How are we doing, Hazel, with completions?
We only have about 60%, so I'm going to give it like 30 more seconds. We have more questions than normal, so.
Exactly, a lot of stuff to read. And as always, thank you for putting your information in the chat. We are recording the chat as well as audio and video and making that all available to you afterwards. So the chat you have to request from us directly with email. We can't put that there in the publicly just, because people are putting their names in there, and we want to make sure we are respectful of that. But you can certainly reach out to us and get the transcript of the typed responses. Our steering committee actually gets a copy of it as well, and we always look at it afterwards. So when there's questions you raise that we can't answer really well, or your suggestions, and you want to throw them in there for our program, then this is something that we look at and that we work on.
And we have 80% now, so I'm going to end the poll and share the results. Oops, I accidentally advanced this one.
Wonderful. And I think now all of us can scroll through it, right? The answers?
Yep, so we can all scroll through, and if you want, you can comment on them. But...
Perfect. So Joseph and Phil, if you want to take a look, especially if you want to scroll to the 5, it looks like focus group is something most of us are familiar with. Feedback loops is something that is a term not quite as familiar. And then community gatekeepers is also something that people are less familiar with or have used less. All right, and you would be able to pull it up again if we need it later, right, Hazel?
No, I think...
Okay, so I will screenshot this in case you guys need it later.
Perfect. Oh yeah, I'm screenshotting it too, so.
All right. Wonderful. And here we go. So as you know, we now have a live feature every seminar. So we get different, so we get insight into recovery community centers and how different they are and how unique they are. Today, we are very excited to introduce Nick Demott from Lifeboat Recovery to you all. And Nick is going to give us some insight into his RCC. Nick, over to you.
Hi, everybody. Yeah, I'm Nick Demott. Lifeboat Network Center is the name of our RCC. We're located in Lansing, Michigan. We launched fairly recently. We've been open since October. So building out the sort of community engagement piece of our RCC has been a little slow going due to COVID. We had a round of shutdowns in November shortly after we opened. And so it's been, we really are trying to set ourselves up as a drop-in center where, you know, anybody from the community can come in, catch a meeting, maybe just have some, we have kind of a lounge area where folks can kind of hang out, talk, socialize. We're trying to build out some sober social events and volunteer opportunities, like some cleanups in the community. And we're starting a community garden, but it unfortunately got flooded. So that one might have to be put on hold till next year. Yeah, part of the focus of our RCC is just our one-on-one coaching. That's probably been kind of the core of what we do. We have, I think, 11 active clients, and then we've done a lot of relationship building with transitional housing programs, treatment providers in the area, community mental health, to set up referral relationships with those folks so that as individuals are transitioning out of their Medicaid funded peer recovery coaching, Lifeboat can kind of be there to you know, fill that gap where if an individual wants to continue services but they run out of funding, they can come over to us. So we're strictly grant funded right now and don't bill. So we're able to be there for folks when some of their other funding runs out. We also have quite a few support meetings. I think we're up to 12 a week right now. Some of them are bi-weekly. But yeah, I mean, we've been seeing around 100 to 120 individuals a month in support meetings, and we're kind of constantly trying to grow that. We have a couple of meeting rooms right here in house, as well as our building has some larger conference rooms for bigger meetings. We're also trying to integrate like a family engagement component, which actually just launched last night with there's another community partner that offers a family support meeting, and they've wanted to expand, so they're starting to meet in person at Lifeboat. And really just throughout the pandemic, we've tried to find ways to offer, you know, COVID conscious in-person support meetings, because a lot of folks have mentioned that was something that, you know, they were really struggling with in their recovery, was not being able to go out and see folks in person. We also have a computer bank here on site. So we have 4 computers that are open to the public. That's kind of during our public drop-in hours, or people can set appointments. We also work with coaching clients, you know, to get on there, and if they need to sign up for public benefits or look for a job or try to find housing. We've also had individuals come in and do community college classes and things like that. So that's kind of just, they're kind of just there for a broad, you know, helping people with sort of whatever recovery capital type stuff they're needing to work on. And, you know, sometimes using a coaching session to really sit down with a client and work on that stuff can be beneficial, because, you know, if they're consistently setting a goal and not reaching it, sometimes you can just take that 1 hour time to help them knock some stuff out and get some forward momentum. A couple other things we're working on is we'd really like to build out a training and mentorship program that's been kind of slow going, but we work closely with some community partners like that provide the CCAR training in our area and have a kind of a wealth of knowledge of, you know, various training modules that they can offer. So we're really trying to recruit individuals from the community that, you know, want to work in the field, want to become coaches, offer them some training, and then also pair that with opportunities to shadow coaching, shadow. There's a hospital-based initiative here in Lansing, not run by Lifeboat, but it's Project Assert. And so just opportunities to kind of shadow some of the peer support services. Like I said, that's still something that's in development, but that's kind of one of our goals, is to really have that up and running. And then 2 other things I'm really excited about that we have kind of just recently launched are the rapid response post-overdose program. So it's a collaboration with some community, like law enforcement, EMS agencies. So Lifeboat and a couple other sort of treatment providers receive referrals from first responders, and then we follow up on those overdoses. The goal is within 72 hours. We're piloting a home visit program, but since September 2020, we've been making phone calls to the majority of the overdoses we're following up on, and it's taken some time to, you know, really get it working well, but we've started to see a lot of good engagement. I think we responded to like 13 overdoses in June, and a lot of those resulted in like Narcan delivery, linkage to various services, whether it's a peer coach, support meeting, finding a primary care doctor, or in some cases, even the individual entering treatment. So that's been really awesome to see. And I kind of lead that coalition. And then the, I guess, final thing I'll touch on before I wrap up, I know I've covered a lot of ground, is the outreach initiative. So I mentioned Project Assert. It's a evidence-based practice that engages people in the emergency room, and Lifeboat is working on expanding that program into some of the homeless shelters and other community agencies that serve underserved populations. So right now we're in the it's called the outreach. It's like an overflow for the homeless shelter, where especially individuals that are intoxicated can go there. So we're staffing a peer recovery coach there a couple hours a week, and we're trying to up the number of hours that they're at that location, as well as expand into some of the other services to really just kind of meet people where they're at. So yeah, I think I'm about out of time, but thanks everybody.
Perfect. Thanks so much, Nick. Greatly appreciate it. Now I will turn over to our presenters for our main feature, so to speak, today. And I just wanted to say that for this particular one, we're going to be taking questions along the way. Sometimes we ask you all to hold your comments until the end, but in this case, Joseph and Phil said to please make this a conversation and to chime in, and feel free to unmute yourself and ask your questions, of course. All right, without further ado, so we're going to have this in a couple parts, to be honest with you. First, I would like to introduce Mr. Joseph Sanchez. He's the Director of Programs at Faces and Voices of Recovery. Joseph has been in recovery since 2005 and is living with HIV since 2003. He's a distinguished graduate of the 2009 Leadership Institute for Recovery Support Service Emerging Leaders, and he has championed local, state, and national peer-based initiatives for active mentorship and servant leadership. Joseph is also committed to reaching out to LGBTQIA+ communities to eliminate homophobia and heterosexism. All right, Joseph.
Thank you. I am going to hopefully do it right. And hopefully y'all are seeing my screen.
We are. We're also seeing it at the bottom. We're seeing two things.
Two things.
So we're seeing the active slide and the slide preview on the bottom.
Okay, so I'm sharing the wrong one. Of course. On a Friday, right? We were talking about summer and people taking some time off there, and there we go. And sometimes the brain does that. That should be better.
Perfect.
Well, great. Thank you. And thank you all. Thank you, Nick. So great to hear a lot of phenomenal things that are happening in your community and all the different ways of engaging the community. So like Bettina had said, my name is Joseph Hogan Sanchez. I use the pronouns he, him, and I am the Director of Programs here at Faces and Voices of Recovery. Really, our mission is in changing the way addiction and recovery are understood and embraced through advocacy, education, and leadership. And we do that through our many different programs. And one of them I'll be speaking to today. So, of course, again, really our focus here today is on the importance of engaging the recovery community and engaging the community in general as it pertains to whether you're a recovery community center or a recovery community organization, however you're set up. And in reviewing some past presentations as well, there's some awesome examples of that engagement. And Nick just gave you, a few examples as well to reflect on, and we'll highlight those as well. So Faces and Voices of Recovery, we are a national advocacy organization, and we formed in 2001. And October this year, we are celebrating 20 years. So we'll be having this huge event in St. Paul to celebrate that. It's an awesome opportunity to, celebrate the strides of accomplishment that we've made as a community, over these past years. But since the kickoff of Faces and Voices of Recovery, we've engaged in a few different things, and one of those things was the opportunity to start to identify best practices and standards for the delivery of peer recovery support services. From that, and I'm going to try to multitask as best I can, from that, the beginnings of those conversations, we pulled, like we are traditionally used to doing, is pulling folks together. Oops, I'm sending that just to one person. Not a good thing. We pulled a whole bunch of subject matter experts together. So these are folks with lived experience, people in recovery as they self-identify, as well as people that peers that were providing services, and recovery community organizations and centers, pulled a whole bunch of subject matter experts together and started to identify the standards. From there, standards committee was formed, and standards for service delivery were really formalized and solidified. So that happened in 2010, and from 2010 to 2013 came the formalization of the Council on Accreditation of Peer Recovery Support Services. So in that same year, in 2013, we accredited our first 5 organizations. And super exciting to see how much that has grown over the years. And I believe we are successful in that upload. So you can see you can download that file. It's a whole final document that came out in 2012, has a summary of, what all went into the creation. And really, from a Faces and Voices standpoint, we really embrace the nothing about us without us. So if there is something that is being done in way of service delivery for people in recovery or seeking recovery, or those folks should be at the table, part of the conversation, leading the conversation, and that's what we do in this process in building out the standards. So that was a crash course, if you will, on some history with CAPRIS, the Council on Accreditation of Peer Recovery Support Services. Bird's eye view, here are the taxonomy. And I see a few folks with some familiar faces that are familiar with the CAPRIS and their standards. So shout out to you all, good to see you. So we start off with our 4 functional areas. I like to call them our 4 Ps. Those 4 Ps are all the standards that relate to people, practices, performance, and principles. Everything kind of lumping under those 4 functional areas. From those 4 functional areas broken down into 7 core domains. From there, 30 standards, 150 criteria, and hundreds of elements of performance. We take a non-prescriptive approach, so we don't say, here are the standards and here's how you have to meet them. Just like there are unique ways and unique communities, we understand and we celebrate. So we say, hey, here are the standards, how are you meeting that? What does that look like for you? And taking a really strength-based approach and celebrating the accomplishments within those organizations. So to bring it a little bit more, there it is. To give you an example, we have this first functional area of principles. The first domain is recovery principles, culture, and climate. You can see the description here at the top. Recovery principles and values are what differentiate peer recovery support services from treatment and from other types of recovery services. So in this section here, we have a description of this domain, and everything really speaks to, throughout all the standards, around who's a part of this process. Are those that are being served, the community, the recovery community, your stakeholders, those folks that are directly impacted, are they a part of those conversations? So we kick off in this first functional area, in this first domain, and it's actually sprinkled throughout all the standards, this emphasis on the importance of lived experience, right? So the standards are on the left-hand side of your screen. We start to abbreviate recovery principles, culture, and climate with RCCs. The first standard there is core recovery principles. Second, core recovery culture and values. Third, recovery climate and environment. So in reviewing that with organizations, folks can say, yeah, we operate by core recovery principles. I'm like, great. How did you identify those core recovery principles? And again, who is a part of that process? So it's very, it's the process that reiterates and reiterates, hey, we're people with lived experience part of that process. And I put some animation here, hopefully it works. So this was back in the day. Oh, yay, it's working. So this is back in the day, and in 2001 at that summit. It was a whole bunch of movers and shakers really coming together. And of course, we've grown exponentially, not only in size and passion, but also in technology. See a better picture there. So this is a pre-COVID picture of our Association of Recovery Community Organizations. We have a leadership summit every year, and we pull our ARCO members together as well as other leaders, and come together in celebration, but also to in information exchange, and being in DC, an opportunity to advocate. So that's really cool. So again, I bring this up because it is an emphasis on where these standards were developed and how these standards were developed. Again, from the community, from the people providing services, and throughout our process, even the review, edits, additions, all with folks with lived experience. So again, nothing about us without us at the table. People with lived experience are directly impacted by what does and doesn't happen within the community. What services we provide or don't provide. It's really thinking about like this supply and demand. If I am a business and I have a great novel idea, but nobody wants my product, of course my business is going to fail. So the important thing is doing our research, right? Having folks a part of the conversations and saying, not kicking down the door into the community and saying, here we are, this is what you need, this is what we have, but saying, hey, how are we doing? What does the community look like? What's working? What kind of resources are involved? And engaging them in a participatory process. And I saw that a dear friend of mine threw that up in chat earlier. That's one of my favorite words, participatory process. And engaging folks in a participatory process to extrapolate what's happening well within the community, and also to identify some of those gaps in services or those cracks that people tend to fall through. So in a participatory process, of course, taking a strengths-based approach. A participatory process that comes to mind for me is appreciative inquiry. It's a very strengths-based approach in asking folks what's going well, and also too a way to get people involved and invested and into being a part of a solution, a part of building out a program, a part of providing a service, a part of your organization, your center. The way to evaluate any type of progress of where you were, where you are now, and where you want to go. It's an excellent opportunity to extrapolate a lot of that information from the community through the participatory process. Also, too, it informs the development of plans, of programming, and how to implement it. Again, I may have some great ideas, but if I hear back from the community that that's not going to work, well, I better listen to the communities if I want a successful program or a service. And of course, it's all about that connection. You know, something that happened last year was this whole disconnection, and Nick spoke about that, this need for connection happening again. And with our centers happening in a community, right? If it's a recovery community center, who does this center belong to? The community. Who should we have a strong relationship with? The community. And so I start to think about, how do I maintain healthy relationships? And that's effective communication, that's honesty, and that's not sporadic communication, that's consistent as well. So with the participatory process, you know, having things in place to have that consistent conversations in place, really strengthening the relationships that we have in our communities. I showed you one specific domain, recovery principles, culture, and climate. I wanted to show you a few other domains where we see this this emphasis of reaching out and assessing and connecting with the community. Again, from the recovery principles, culture, and climate, we have that first standard. The program is grounded in the values of the recovery community, both local, community, and national movement. But with the local community, how do you identify, again, what the local community values if you don't engage them in that conversation? The second functional area of people, all the standards that relate to people, we look at peer leadership development. And whether you're a recovery community center or recovery community organization that has a capacity to have employees and staff, or you're running and operating on volunteers and their donations of time and services, how are we intentionally building up leaders within those organizations and those programs? So I've highlighted here too, peer leadership development, training and development, and retention. Nationally, we are seeing this this need for peers, this call for peers, this funding that's coming down for peer recovery support service delivery. The retention rate, sometimes not so good, right? So how are we setting up intentionally within our organizations, within our programs, how to keep folks involved, how to keep, whether it's our staff or our volunteers, involved? So the program provides peer leaders with training to help them gain the knowledge and skills necessary for their assigned job, to help them develop within the organization. If I'm employed within an organization and I have no idea how I can grow within the organization, if that is even a possibility, am I going to stay? Probably not. So how is the organization or the program intentionally building up that ladder, so to speak? And what do people want in way of knowledge, additional knowledge? Maybe I'm providing that one-on-one kind of peer coaching or peer support or peer mentorship. But after a while, I'm kind of like, I'm over it. But I do want to, facilitate groups or training within the organization. Is there additional training built in that I can learn those skills? Or even some line item budgets that intentionally are set aside that will help develop me professionally. So engaging people in a participatory process. So we're looking at community in a few different levels, right? This is looking at community within our organizations, within our centers or our RCOs, and looking at that internal community and saying, okay, let's talk, what's working well. and where do we want to go from here? Also, too, on the retention standpoint, if folks are being built up in an intentional way, and we have opportunities to recognize, to engage, to increase that leadership potential, retention, supply and demand. Again, what is going to keep you here? What keeps you here, and having conversations around that, whether it is a formal process or even collecting information from exit interviews, or those types of settings. I'm keeping my eye on chat. I don't have any questions coming in, but please do not hesitate to interrupt if you have a question. Another functional area, practices, the practices that we have put into place. The domain here is management systems. All the systems that we have in place to manage our organization, all the bits and pieces. I have highlighted here the organization establishes ongoing data-driven quality assessment and improvement processes and methods. So having things in place, not only to say, oh yeah, we've engaged folks in a participatory process. Well, what did you do with that information? What information are you collecting? Who was a part of that process? How diverse was a community that you engaged with? Who's missing from the table? What did they say? How did you have that re-engagement? Is this correct in what we heard? How do you circle back with them and let them know that this is what we heard and we're creating this plan? All of those things, having that quality assurance being put into place. So through the CAPRIS accreditation process, we look for those elements. What is in place to not only capture, but to follow up with, and so that's around quality assurance within programs. So we look at another layer of community, and that might be the community of the folks that you serve, or the community of collaborating partners or stakeholders. So there are multiple levels when we start talking about the communities that we serve. And then, of course, performance. This functional area, it's not functional area 2, it's functional area 4. But in this functional area, we look at the domain of peer support capacity core competencies. What we are looking at here within this highlighted standard is how we are determining community strengths and needs, and really honing in and focusing on our topic today around that engagement and community engagement. So we have within that standard that the program uses a participatory process to assess community strengths and needs. How are you doing that? Who's a part of those conversations? And when we start to identify community, which levels of the community? If you're serving, if you're doing harm reduction work, then the community looks different. And if you're doing, if you're serving a plethora of different types of services, from hosting or being a host spot for mutual support meetings to doing outreach and needle exchange, you have a whole bunch of different types of communities. So again, how are you building relationship, maintaining relationship, engaging in a participatory process to assess those strengths? So I'm going to turn it over to Bettina here. And I don't know if I'm highlighted or pinned, but we can, there you go.
I should unmute myself. That will probably help. All right, quick science interlude. I'm trying to rush through it to get to Phil soon. But basically, I mentioned the steering committee that we are meeting with regularly. And two questions that arose there was, how do you actually assess the community level impact of RCCs? We just talked about how important it is that, RCCs are the community and they're existing in a neighborhood. So they're not just impacting individuals, but also communities. But how do you measure that is challenging. So that was one of the questions that we are modeling and looking into. And then one of the things that was also brought up is that there is some negative neighborhood level effects that happen where there are the not in my backyard kind of attitudes that really prevent RCCs or some RCCs from doing what they want to be doing and that make their life very difficult. And then the challenge becomes of how do you address those situations? How do you overcome them? How can you put systems in place and build relationships ahead of time to really alleviate that and to have channels of communication open to address them when it does happen? So those are some questions that arose from our steering committee. And then in our most recent seminar, Chet Sabora highlighted the utility of having some facts and the advocacy of drawing to empirical findings and saying this is what it's actually looking like. And then the other reason we have a science interlude is because we do have a program for funding pilot studies. And so if you're interested in doing the kind of studies that we need, this is definitely an area that we need to do. So without further ado, let's talk about some concerns that people have raised anecdotally in the past about crime and property value for substance use disorder oriented settings. First off, I should say that none of this is my work. This is there's other people's in the field. It's pulled from literature, and we have all the citations listed below. So just that you guys are aware, I don't want to take credit for things that aren't mine. But here is an example about crime incidents around methadone maintenance treatment centers. And the premise of the study was that there's a concern about crime being a significant barrier to the establishment of methadone treatment centers. So in Baltimore, they looked at 13 clinics and compared them to 13 clinics for 13 controlled settings, residential points, convenience store, and general hospital settings. And then they pulled the data from the Baltimore City Police Department collected from 1999 to 2000, and they compared what are the crime rates at these different settings. And what they found is that the methadone clinics were not associated with more crime, but that the convenience stores were. So that's one way in which you can kind of assess the community level impact in terms of crime. Next slide, if you would. Very similar, but a little bit bigger, is again, the not in my backyard syndrome has been repeatedly observed in the placement of SUD treatment centers. And particular interest here is now violent crime. So not just any crime, but violent crime was the center of this one. And they looked at, again, in Baltimore, they identified 53 substance use disorder treatment centers. And then they located all the liquor stores in the same area, all the corner stores in the area, and all convenience stores. And then they matched those. They found one match for each of a treatment center based on a neighborhood disadvantage score. So these will be matched controls. Then again, they looked at the police department records, which listed 9,378 violent crimes in the year of 2011. And then they compared the crime rates across the different sites. And here the finding is that there was more crime around liquor stores and corner stores than treatment centers. And for treatment centers and convenience stores, it was about the same. So again, alleviating concerns. Next slide. In this one, we are looking at property values. So there's anecdotal claims that substance use disorder treatment centers reduce the residential property values. And the design here is that they now looked at the center locations of substance use disorder treatment clinics in the Seattle area, well, actually in Seattle directly, but they looked at it over a larger time frame, 2003 through 2018. And then they looked at the Department of Assessment's record of property sales to look what the values were, and did a spatial analysis, both cross-sectionally at the same time as well as over time. And the naive assumption does hold that the treatment centers were indeed located in lower property value areas. But, and this is the important part, when you look at it over time, the entering and leaving of a treatment center didn't impact property values in the neighborhood. So it was just that they happened to be located in those areas, but it wasn't the creation or closing of these centers that impacted that. And here's the citation. Next slide. I only showed you, there isn't a lot of this kind of data out there. I do want to mention these 3 studies. They aren't more of what we saw on property value, that there were a couple more on crime, where there is also some mixed effects here. There was a negative impact found for halfway houses, a mixed impact regarding outpatient methadone treatments centers, and then again, another study on a positive impact, and you have these slides with the further details. But if you go to the next slide, the take-home message that I just want to make is that for RCCs, this kind of research doesn't exist. What I just showed you is relevant, but certainly not the same. So we need this kind of research. The findings on crime were not unanimous, but largely alleviating concerns, and property value, that research really hasn't been done a lot. So much to the science findings. Hazel will put the PDF file of these full-scale papers in there, and if you have any questions, feel free to mention them. The reason I just sped through this is because I want to make sure we hear from Phil. Mr. Phil Rutherford is the Chief Operating Officer at Faces and Voices of Recovery. He is a recovery coach, a passionate member of a recovery community, and possesses a self-described doctorate from the School of Hard Knocks. Among many other things, Phil played a key role in the conception, design, launch, and facilitation of a recovery data platform, which probably most of you are familiar with, but it is a cloud-based platform to collect longitudinal data for peer-based services. Phil?
Thanks, Bettina. And I want to start with the concept of different strokes. And my daughter the other day, my youngest daughter is 17, and I said something about different strokes, and it hurt me to my heart because she said, "What's that?" Right. So I want to make sure I know the age of the audience. Different Strokes was a sitcom in the 70s. Okay. We're talking about community engagement here, and I chose Different Strokes because it really is a story of different strokes for different folks. It looks different across different communities. I've been blessed with the opportunity to visit lots of RCOs around the country and be pretty closely involved with a few of them. So we're going to talk about a couple of those examples. I think it's key to remember that success metrics for everyone, even for engagement efforts, are not universal. It's something that is much more of a case-by-case basis. And the organizations that I'm going to talk about have used a variety of different community engagement strategies to get at the same goal, both at the individual and at the agency level. Next slide, please, Joseph. So just to make sure that we're all talking about the same terms, you guys probably already know this. I know we've got researchers on the line that could probably tell us about the specifics here. But when I say urban, I'm thinking of areas with 50,000 or more inhabitants. And this is, I'm using the census definition. Suburban really isn't a census definition. The census talks about micropolitan statistical areas, which is a mouthful, but that's roughly between 10 and 50,000 inhabitants. Rural is less than 2,500, and frontier is less than 11 inhabitants per square mile. And actually, from the examples, there's an RCO that's serving all of those. Next slide, please. So we went through the list and we asked you guys about engagement strategies, and it seemed like everyone was pretty familiar with most of them, with the exception of the feedback loop and community gatekeepers and influencers. And it's not that there's any special secret to those. The feedback loop strategy is just basically focused on connecting with particular members of the community and engaging them directly. And similarly with gatekeepers and influencers, it's about finding the right people. And I'll apologize in advance if someone's been on a call with me in the past 6 months. You probably heard this story, but there was we're doing some hiring at Faces and Voices, and there was a young lady that joined us, and she had to do some administrative work. And she was not a person in long-term recovery and didn't come from sort of inside the recovery community world. And we were talking about that in our interview, and she said, "Well, I'm pretty sure I can do the job, but I don't know anyone in recovery." And earlier in the interview, we had talked about her background, and she grew up, her father was a pastor. So she's very connected to the African-American church in Chicago. And so I knew that she knew some people in recovery, just because that's in churches, there are people in recovery all over the world probably. And I said, "Well, so do you know anyone that used to drink a lot and now doesn't drink anymore?" She's like, "Oh yeah, I know plenty of people like that." And I said, well, you know anyone that used to maybe have trouble with legal consequences or maybe get locked up? And so, oh yeah, I know plenty of people like that. I'm like, well, maybe some of them are in recovery. And she said, oh no, they're saved. And something about that stuck with me, right? Something about that in our engagement strategy stuck with me, because for all of our intent about talking about recovery and reaching into communities, her understanding of recovery was saved, right? And it's not, and the thing is, that's just a terminology thing, but the people that she was talking about, because we talked about it a little bit more, the people that she was talking about were living by a program of recovery that we identify, at least on this side of the fence, as that. So I said that to say that the engagement strategy is really specific and dependent on what community you're trying to get into and what you're trying to deal with. So next slide, please. I'm not going to spend a lot of time on Twin Cities Recovery Project, because you guys had the opportunity to hear from Mark last week. He's a wonderful gentleman. The spirit of full disclosure, I'm connected with both of the Minnesota organizations I'm going to talk about. I'm connected with them, so I have a pretty good idea of what the work that they're doing. Mark is really good at connecting with the community. He has gone intentionally and it's not true of every Black community, but a lot of Black communities, this work goes through the church, and it goes through a set of community organizations. And that is what Mark has done. He's started an organization that started kind of as a social club or almost like a drop-in center, and has developed that into a rich offering of robust services. So his engagement strategy was to deal directly with community leaders and try and bring them into his organization and let them see what he was doing. That also worked pretty well with NIMBY. But you guys heard about, well, if you were here last week, you heard about Mark. If not, please look at the recording, because it's a wonderful chat. Next slide, please. Doc's Recovery House, also in Minnesota. Strange coincidence that I live there. I know I'm talking about two Minnesota RCOs. But anyway, Doc's Recovery House is actually a unique thing in that they do pre-treatment housing. And I don't know how many organizations around the country do that, but Minnesota is really good about getting people treatment. I mean, you can get, even before ACA, before the Affordable Care Act and before Medicaid expansion, Minnesota, if you wanted treatment, you could basically get it, but sometimes there was a wait. So one of the premises of Doc's Recovery House is to, when someone says they're ready for treatment, there would be a wait 7, 10, 14 days before they could get there. Doc says, come on in, we'll stabilize you and help you get ready to go to treatment. Their engagement strategy in the community was a little bit different than Mark's. They went at civic clubs, they went at private fundraising and Chamber of Commerce. And one of the interesting things about them is I think they finally got a grant this year, but for the first 4 years, they operated completely free of state and federal funding. It was all driven by raising money at the private level, working with local businesses, and generating funding away from the private thing. And those of you that know me know I'm a money guy. So it was really exciting to me to see an organization prop itself up without grant funding. So their engagement was with the community, but like a lot of times when we talk about community engagement, it's almost as if we forget that the business community is part of the community. They're members and they are to be engaged just like any other part of the community. We definitely want people that are underserved, and we want people that maybe don't have a voice, but Doc's work with the business community is what kept their doors open and kept peer services flowing. So they have a grant now, but they're good. Next slide, please. This next organization, and I'm really excited, their executive director, at least at one point, was on the call, unless she got to this part and said, Phil's talking, I'm out of here. But Mary Jo McMillan's their executive director. And I use them as an example because they're actually a statewide organization. But if you see this little map on the slide, the green parts are places where they have offices. So they have an office in Salt Lake City, but they also get out to much smaller communities. And if I'm not mistaken, Mary Jo can put it in the chat if I'm wrong, but I think there are 5 offices now, and they really do support everything from, sort of, Salt Lake City is urban, right? and suburban, but they support everything up to and including frontier folks that are coming in and working with the rural organizations in those small communities. So it turns out there's a faith community in Utah, just like everywhere else. So they've been involved with them. Mary Jo is diligent in terms of dealing with government. So she's connected with county commissioners. They've done town halls and listening sessions in each of their locations. And also I feel like I noticed in the chat, someone from one of the universities there, something that they've done that is particularly, at least from my perspective, unique, is engage with local universities to help them not only broaden their capacity, but really strengthen the infrastructure and identify and document the work that they do. Because again, the university is part of the community, right? So I really appreciate some of the ways that these organizations have stretched the envelope. And I think that there's so much to be learned from all of them. What's one of the neat things about being in an organization that has ARCO. ARCO, as an acronym, it stands for the Association of Recovery Community Organizations. And in that, organizations that are just starting out have the opportunity, like all of the people that I've listed are members of ARCO, and USARA is in the CAPRIS accreditation process. So they get to learn from each other in this, and I think it's a really nice setup. So next slide. Lessons learned, definitely different strokes. Culturally specific support is important, and when I say that, I'm not just talking about like you got to have a Black RCO and you got to have a RCO for Indigenous people. That's not what I mean. I mean that, comma, and there are cultural differences even in states, right? Like, so a rural RCO in Minnesota is probably a little different than a rural RCO in Utah, but some of the same strategies can be applied there. And I just noticed that Troy was I see Troy's picture now. The business of building the thing that I was talking about with Utah and building infrastructure, they have these things called practice profiles where they describe what the work is in the department. That stuff can be overlaid across different groups, but it's still important to have people that are familiar with that particular demographic or cohort actually delivering the services. My other lesson learned or takeaway here is that NIMBY is a real thing, but it melts away in person. And I like the quote, "It's hard to hate something up close." All three of these organizations have expressed that they've expressed that they've dealt with NIMBY. And I'm sure most RCCs deal with some kind of NIMBY, not in my backyard. And indefinitely, and I can't speak to all of the locations in Utah, but definitely at Docks and Twin Cities Recovery Project, in most cases, people that were unhappy or distrustful of them to begin with have grown to love them in the community. So it's about getting to know people.
It's 12 o'clock.
We're also a long way from saturation. Lots of room for more of these organizations. I got a quote here from Tip O'Neill, says, "All politics is local." All of these organizations work their local politicians relentlessly, which is probably why they're successful. And I just wanted to call out DRH, Docks Recovery House, and USARA as being engaged in the business community, and I think that's important. That's it for me. It's noon. I was told never to stand between good people and their meals, so I'm going to get off the stage.
Thank you so much, Phil and Joseph, for excellent presentations. I know it is noon. Feel free to log off. I know you probably have other things to attend to, but if you do want to ask some questions, Phil and Joseph, do you have a moment to still answer questions? And please unmute yourself or put into chat.
Yep, I do. Should I take down slides now?
Yeah, if you could, so we can see each other. And if there's no questions, then we can all go and have some lunch or attend to our next meeting.
I also put the poll up on screen that people can do if they want, but no worries,
Exactly.
We have to rush.
It's Bettina, it's because we covered it so well that we simply left no doubt. Everyone. Also, thanks to people, I saw a couple of people say they were coming to our party in Minnesota. I didn't notice that every single person in the event said they were coming, so that was disappointing. But if
they were
everyone,
waiting for the poll where they can say, yes, I will be there.
yep, if you guys, I can see your email addresses. So unless you want 10 emails from me, please come to our event.
Wonderful. All right. Well, if there are no questions, I want to just thank everybody, Nick, Joseph, Phil, Ramona for capturing for us. It's been great. And all of you who are coming and attending, please feel free to actually reach out with questions, comments, anything. We always want to improve and grow. And then we will have a little bit of a summer break, and we are looking forward to seeing you all on October 1st when we return. Thank you all. And Hazel, you can stop recording.